Yes, I know. I know. I am talking about hysterectomies again, but this is something that I think that you should absolutely know. What's up to my favorite bunch of beauties? Welcome back to the channel. Today I wanted to talk about some post-hysterectomy complications that you definitely need to know. Do know that most people do heal perfectly fine after hysterectomies with no complications at all, especially if they follow the advice of their providers, and don't try to do too much. I know I had someone that I talked to about it who decided that she wanted to do what she wanted to do, and she almost got into trouble after her hysterectomy was one of the things that I'm going to mention. The first one that I'm going to mention is something that I am going through now, and it's kind of rare that I'm going through it now because I'm almost a year out from my hysterectomy, and that is vaginal cuff cellulitis. So the vaginal cuff is the area where they, if I'm saying this correctly, where they kind of close you up from the hysterectomy. And the vaginal cuff cellulitis is an infection, and it's sort of when bacteria sort of gets into that area. I think more people sort of have it like closer to the date of the hysterectomy because that area is still healing. Not sure why I am going through it. It could be because I am a diabetic. It also could be from bacterial vaginosis, which is something that we go through all the time. When you have like this imbalance in your sort of vaginal flora, you can get bacterial vaginosis. So it could have also been caused by that. I did go, sorry, I did go and speak with my doctor regarding the symptoms that I was having. Like I was having a lot of pressure. And I'm just going to say it like it is. This is not a video for children. I'm sure children don't want to hear about hysterectomies anyway. But I was having a lot of pressure in the pelvis after I urinated, which I'm still having. And I was having something that looked like blood, like brownish colored discharge, which was very concerning to me. So I went and had an evaluation. The doctor told me that that vaginal cuff area looked angry and really red and just angry. So she gave me metronidazole tablets, which is for BV. This is because we were just assuming that it could have been that. That didn't really help. So then she gave me, I think it was Augmentin. That didn't really help either. So just this past Friday, I had to go to have a CT scan done. I'm still waiting for those results to see if I have some sort of abscess or some kind of bladder injury somewhere. So yeah, that is the first thing I wanted to talk about because it is something that I am going through, which is vaginal cuff cellulitis. Do know that, like I said before, most patients do perfectly fine after hysterectomies. They heal well and they don't have issues. But these are things that in the back of your mind you should know could be a possibility. So you want to be really careful with yourself after your hysterectomy. The next thing, before I finish with that, I do want to say, if you notice, like I did, that you are having these symptoms and they are concerning to you, please make sure you reach out to your surgeon or to your OBGYN, or probably it's the same person. Let them know about your symptoms. Take care of it early so that it does not turn into something a little bit worse. The next thing that I want to talk about is vaginal cuff dehiscence. And vaginal cuff dehiscence is where your sutures come apart. And of course, that can happen early after the hysterectomy. That, I think, in my opinion, is something that is totally avoidable. You have to do what your surgeon tells you to do. If they say no sex for 6 weeks, no sex for 6 weeks. No heavy lifting, don't lift. Please take your time, listen to your body, because once those sutures come loose, you could run the risk of something even worse, like the intestines coming through that incision that opened up, and then you run into even more of a problem. So you want to know that if you have a sharp pelvic pain, if you all of a sudden start bleeding after your surgery, contact your doctor immediately. But it is important to rest after that surgery. Don't try to be He-Man or She-Ra or whoever you are. Don't try to be that person. Get somebody to help you. Rest as much as possible. Avoid, like I said, having sex before the 6 weeks or before actually you are cleared by your surgeon to have sex. And no heavy lifting. If they say don't drive, don't drive. You're using muscles that you don't know that you're using. Take it completely easy, and something like vaginal cuff dehiscence can completely be avoided in most cases. The third thing I want to talk about is not vaginal cuff, it is pelvic floor dysfunction. So pelvic floor dysfunction is where you sort of start having like incontinence. You can't hold your urine. And sometimes after a hysterectomy, those muscles can be weakened. So you can run into those issues. You can also run into the issue of painful intercourse because of pelvic floor dysfunction. So the tips that I want to give you, and I'm looking at my note, is Kegels. Kegels is just the practice of holding your urine, using those muscles that you use to hold your urine. Even if you're not urinating, even just sitting in a chair, you can do it. Just like tighten those muscles up for as long as you can and release them, and do it as often as you can. And that will help you to sort of build back up the muscle strength in that area. And if you want to do it just as a preventative thing, you can, even if you don't necessarily have that problem with the pelvic floor dysfunction or the incontinence of urination. Just try sort of tightening those muscles up anyway. It never hurts to do it. Just tighten them up anyway, and in the long run you'll be better off for it. If you are running into an issue with incontinence, of course, reach out to your doctor. The first thing she's probably going to tell you, though, is to do those Kegel exercises. So the next thing I want to talk about is bladder or bowel injuries. Now, this is something that is extremely rare during surgery, but there can sometimes be the incidence of having the bladder or the bowel nicked during surgery. So you want to sort of monitor your bladder and your bowel habits after you have surgery. And if you notice any changes, you want to reach out to your doctor as soon as possible so that if something needs to be repaired, it can be repaired. The next thing I want to talk about is hormonal fluctuation. So if you have a hysterectomy and your ovaries are also removed, that is going to throw you into sort of a surgical menopause. So you'll be having the hot flashes and the night sweats and all of the other things that go along with menopause. You want to talk to your doctor possibly about hormone replacement therapy. If you are not a candidate for hormone replacement therapy, you want to talk about alternative options, even some more holistic options. I know that some doctors recommend black cohosh, but there are also things like phytoestrogens. There are some lifestyle changes you can make. All of those things you can talk to your doctor about if you start to notice that you are having these symptoms. The next thing I want to talk about is lymphedema. And lymphedema is like the swelling of the lower extremities if you have any lymph nodes removed during your hysterectomy. What you want to do is to, of course, talk to your doctor about it. You can do certain exercises. You can wear compression stockings, or you can have a lymphatic drainage massage. You want to look out for any swelling in your lower extremities, so your legs. You want to look out for it in your abdomen and in your lower abdomen or your genitals, any swelling or discomfort. And you want to make sure you reach out to your doctor so that you can have some sort of early treatment for that. You don't want something like that to sort of linger on. The next thing that I want to talk to you about is adhesions. And what adhesions are is like a post-surgical scar tissue that can form and sort of bind your organs or your tissues together. And it can cause either pain or it can cause like a bowel obstruction. You want to reach out to your doctor and speak with them if you are having any kind of chronic pain or any kind of bowel issues or digestive issues. They can do a minimally invasive procedure or surgery to sort of break up those adhesions. And then you can do stretching exercises or gentle yoga that can help prevent further complications. And the last thing that I want to talk to you about is nerve damage. So nerves in the pelvic region can be sort of inadvertently damaged during surgery, and it can cause you to have numbness or long-term pain in the legs, the abdomen, or the groin area. You should communicate with your surgeon if you are having any pain or discomfort, and there can be treatment options that they can talk to you about. They can send you to physical therapy. You can even get a nerve block or something like that. Nerve block is an injection to help with the pain. I don't know that there is a solution to permanently getting rid of the pain because you have nerve damage. Once you have nerve damage, that is something that cannot be repaired. So there are options for making it less uncomfortable. So I want to just kind of round it up with some general recovery tips, and then this can sort of help you to avoid a lot of the stuff that I talked to you about today. And the first one is ask questions before surgery. You want to talk to your surgeon. You want to ask about the potential risks and what you should expect during your recovery. You want to take time out to rest, like I mentioned earlier. You want to make sure you are taking time out to heal. You want to make sure you are following the advice of your surgeon and avoiding strenuous activity. The next thing I want to mention is to make sure you attend all of your follow-up appointments. It is extremely important to go to all of your post-op appointments so that your surgeon can catch anything that may be a complication early. And the last thing that I want to mention is support groups. Now, before I had my surgery, I watched a lot of YouTube videos of people who had hysterectomies, which it really helped. It really showed me, first of all, how to prepare for my surgery and then what to expect after my surgery. There are also a lot of online forums for patients who are going to be going through hysterectomies. I found a few of them on Facebook for sure. But it helps to kind of hear from women who have gone through a similar situation to what you're going through, so that mentally and physically you are prepared for the actual procedure and then how you are going to recover afterwards. Thank you all so much for watching this video. If you enjoyed it, please give it a thumbs up and subscribe to my channel. If you are already subscribed, please make sure you hit that notification bell so you know when I have a new video coming out. Have a great day, and don't let your day be a waste of makeup. Bye.